Hey everybody, and welcome to another lecture from CyberMD. Today we will be discussing the basics of EKG as it pertains to the USMLE STEP 1 exam. First, we will discuss electrical signaling in the heart and the structures that make it possible. The sinoatrial node, or SA node, is a small area located in the right atrium near the opening of the superior vena cava. It is composed of specialized cells called pacemaker cells, which have the ability to generate electrical impulses spontaneously. These impulses then spread throughout the atria, causing them to contract and pump blood into the ventricles. The SA node is considered the natural pacemaker of the heart, meaning it sets the rhythm and the pace of the heartbeats. Bachmann's bundle is a structure that serves to conduct the signal from the SA node to the left atrium so that both atria contract almost simultaneously, creating a smooth system of blood flow throughout the heart. The atrioventricular, or AV node, is another specialized area of the heart in the interatrial septum, which separates the right and left atria. It receives electrical signals from the SA node and conducts them to the bundle of His. The AV node serves as a safety valve for the heart, ensuring that the electrical impulse is not conducted too quickly through to the ventricles. The bundle of His is a bundle of specialized fibers that run through the interventricular septum, which is the wall that separates the right and left ventricles. It receives the electrical impulse from the AV node and conducts it to the left and right bundle branches. The left and right bundle branches are two branches of the bundle of His that conduct the impulse to the Purkinje fibers. The left bundle branch conducts the impulse to the left ventricle, while the right bundle branch conducts the impulse to the right ventricle. The Purkinje fibers are specialized fibers located throughout the ventricular muscle that spread the impulse to the rest of the ventricular muscle, causing it to contract and pump blood out of the heart. The Purkinje fibers are structures that serve to disseminate the cardiac pacemaker potentials to the distal portions of the ventricles. Next, we'll be talking about pacemaker rates and the speed of conduction. Pacemaker rates and the speed of conduction are two interrelated concepts that are very different. Pacemaker rates refer to how quickly each node or signaling structure within the heart conducts if it is left to conduct on its own. The SA node is the fastest at 60 to 100 beats per minute. The AV node is the second fastest at approximately 40 to 60 beats per minute. You also have the bundle of His, which is approximately 40 to 60 beats per minute as well. And last are the Purkinje fibers, which pace at about 20 to 40 beats per minute. Again, that's if they are left to pace on their own. The speed of conduction, however, refers to how fast the node or signaling structure disseminates its signal to the associated signaling structures and the associated myocardium. The His Purkinje fibers are the fastest, followed by the atria, the ventricles, and finally the AV node. This makes sense intuitively when you think about it in terms of a heartbeat. The AV node must be the slowest, as there must be a delay between the contraction of the atrium and the contraction of the ventricles. This way, the ventricles can fill completely with blood before they contract. And the Purkinje system must spread its signal the fastest, as it has to cover the entire ventricle, which covers the largest distance and the most surface area. This leaves the atria and the ventricles somewhere in between, and it should be easy to remember that the atria are slightly faster than the ventricles in this regard. Just remember that blood enters the atria first. Now, let's move on and discuss the various components of an EKG. The EKG is a non-invasive procedure that measures electrical activity within the heart. Electrodes are placed on the skin and connected to an EKG machine, which records the electrical impulses as they travel through the heart. The P wave represents the electrical activity of the atria, specifically the depolarization of the atria. It is typically the first wave seen on an EKG. The PR interval is the time it takes for the electrical impulse to travel from the SA node to the AV node. It is measured from the beginning of the P wave to the beginning of the QRS complex. The QRS complex represents the depolarization of the ventricles. The Q wave is usually not present or it is very small. It is a negative or downward deflection in the tracing after the P wave that occurs before the R wave. The R wave is the first positive deflection, and the S wave is the first negative deflection after the R wave. The J point is the point where the QRS complex and the ST segment meet. The ST segment represents the period of time when the ventricles have depolarized but are not yet repolarizing. It starts after the J point and ends at the beginning of the T wave. It is usually isoelectric, meaning it is at the same level as the PR segment. The QT interval is the time it takes for the ventricles to complete depolarization and repolarization. It is measured from the beginning of the QRS complex to the end of the T wave. It can be affected by heart rate as well as some pathologies and medications. The T wave represents the final phase of ventricular repolarization. The T wave is important to note in EKG interpretation because it can be affected by conditions and electrolyte abnormalities. The U wave represents late phase ventricular repolarization and is often absent on ECG tracings. It can be a benign finding, but may also represent pathology or electrolyte abnormalities. On this last slide, there is a photo that associates the P wave, PR interval, QRS complex, ST segment, and T wave with the nodal and signaling structures. Please take a moment to understand which EKG tracing component is associated with each structure, as it is crucial to the EKG foundation and being able to interpret EKGs on your exams and in the clinics. In conclusion, EKG is a crucial tool in understanding the electrical activity of the heart and identifying potential cardiac issues. It is an important topic to understand for the USMLE Step 1 exam and for medical professionals in general. Remember to pay close attention to the P wave, PR interval, QRS complex, J point, ST segment, QT interval, and T wave when interpreting EKGs. Thanks for listening, and please remember to like, comment, and subscribe to our content so that we can continue to create free medical education resources for students around the world.